Hello, I'm Michael Good, CEO of University of Utah Health, and today we present the COVID-19 update for November 10th, 2020. As you've been following, coronavirus is spreading rapidly in our nation and in our state. For several days now, we've seen over 100,000 new positive coronavirus cases each day in the United States, and our death rate is over 1,000 individuals each day. Similar situation here in the state of Utah with several days now of well in excess of 2 and in fact approaching 3,000 new coronavirus cases each day, the highest point in the pandemic for our state. And we've also seen now the death rate climbing from a very low rate to typically on average, 7-day average of 5 or more Utahns dying each day from coronavirus. The virus is clearly spreading rapidly in our state and having serious effects for our citizens. We showed you this chart a couple months ago. It's the leading causes of death in Utah. And as you can see, as in most of the United States, heart disease and cancer are the leading causes of death together, about 50% of Americans. But unfortunately, the coronavirus now has increased to where it's a higher cause of death here in Utah of traffic accidents, Alzheimer's, stroke, suicide, diabetes, and of course, traditional flu and pneumonias. So the virus, again, spreading and wreaking havoc on the health of Utah. We've showed this chart before, the number of active infections, and at 38,000, closing in on 40. That means almost 11 out of every 1,000 Utahns now has a coronavirus infection. This is 2 and 3 times higher than where we've been most of the pandemic. And again, the trend continues to increase, which means that each individual who has a coronavirus infection, often minimally symptomatic or asymptomatic, is spreading it with more than one individual. And so the virus is accelerating the spread throughout our communities. Testing positivity rate now actually crossing 20% here in the last day or so. This is the 7-day rolling average of test positivity. Over 20%. Health experts really identify 5% as the goal for when you've slowed the spread of the virus down to a much lower level. This is the breakout of positive cases by age group, and we now see all age groups with accelerating or increasing rates of coronavirus. Recall that it was first the 15 to 18-year-old group where we saw this inflection point in late August, early September, then some plateauing, but now again, really accelerating to quite high levels. And from there, with infections spreading into the adult groups, the 25 and the 45 to 65-year-old. And this is particularly worrisome, the 85-year-olds and up, where the virus is particularly harmful and can be particularly deadly, now approaching 70 per 100,000 in that age group. Similarly, the 65 to 84, again, also a worrisome group to have this much coronavirus spreading among individuals of that age. So if we have more cases, the significant rise in cases, our trends in hospitalizations continue. We are now up over 400 Utahns in a hospital somewhere in our state with a continuing growth or increasing trend. And over 150 individuals, actually pushing 170 individuals in an ICU with severe forms of coronavirus. Our health professionals across the state, especially our critical care nurses, our critical care physicians, respiratory therapists, and all the staff, including environmental service workers who take care of our ICUs and each day now are working to find ways to care for more and more ICU patients as this pandemic really has an impact on the state of Utah. The same trend we've seen here at University of Utah Hospital with continuing high rates of admission for COVID-19, and a census actually earlier yesterday, our census hit a new high. We had 65 individuals in University of Utah Hospital with coronavirus. We had a slight decrease in that as there were some discharges over the last 24 hours, and we have been able to maintain our surgery schedule. But again, some of the highest number of coronavirus patients in University Hospital since the pandemic began. Also with, again, we're starting to see, as we've seen in other parts of the pandemic, an increased portion of severely ill patients who require care in our intensive care unit. Things remain calm on the University of Utah campus. This average, which has run between 20 and 30 during the pandemic, had been down in the lower 20s, inched up a little bit toward 30. But as you can also say, there are days when there are very few individuals identified with coronavirus. So the situation on the University of Utah campus continues to have a low level of virus we're not seeing the kind of accelerating spread in our campus community that we're seeing in the community more broadly throughout Salt Lake County and the state of Utah. I shared with you last week that we were fortunate to be visited by CDC Director Dr. Robert Redfield and White House coronavirus panel expert Dr. Deborah Birx. And in their, as consistent with our data, and they do watch the data state by state, they feel strongly that particularly asymptomatic individuals in the 15 to 24-year-old group are responsible for a lot of the spread that we're seeing. And that's certainly consistent with some of the charts that we've been looking at over the past few weeks. They also, in addition to meeting with us here at the University of Utah, met with our state leaders, and I believe in large part helped to shape the declaration by Governor Herbert on Sunday evening of a state of emergency and some new statewide measures, including a statewide mask mandate, a reduction or an elimination of extracurricular activities with just a couple of exceptions, really a focus on social gatherings, really trying to restrict social gatherings to your household members only, and only then in small groups. And then again, based on the recommendations of Dr. Birx and Dr. Redfield and their commitment to help us get the testing kits that we need, a strategy to regularly and hopefully weekly test college and university students. We will be beginning that activity, that testing of our students, beginning tomorrow here on the University of Utah campus, with a goal of getting all our students tested at least once before the upcoming Thanksgiving break. So students can know whether they're one of those asymptomatic individuals. They may not even realize they have coronavirus. Our asymptomatic randomized testing for the last 2 weeks, we had another nearly 600 students tested last week, random asymptomatic testing, again, with only 6 positives as we had the week before. Good news, very low level of virus in our campus community. The bad news is those 6 individuals this past week and the 6 the week before did not realize they had coronavirus. They were completely asymptomatic. And this leads to the recommendation of Dr. Birx and Dr. Redfield for this regular weekly testing of students. One of the ways that that's possible are because of the evolving testing capabilities and particularly point of care tests. This is the one that Dr. Birx and Dr. Redfield made available to us to begin our campus testing. It's an antigen test It does require a front of the nose swab, not a back of the nose, but a front of the nose. An individual can self-swab the front of their nose. It's inserted into the small card. The card is about the size of a credit card. You can see here, this is the swab that's been inserted into the card. And then within 15 minutes, a readout of either one line indicating a negative test or 2 lines indicating a positive test. So this is the test that we'll use for our initial round of student testing. And we are also working to secure some of the other testing kits and testing modalities that are now available. So clearly the virus is moving rapidly in Utah. It's moving rapidly in Salt Lake County. We really must change our behaviors. Please wear a mask everywhere. Masks are our medicine. Masks not only reduce transmission if you happen to be an asymptomatic carrier, but they also reduce the amount of virus that you will encounter if you unknowingly are around someone who is positive for coronavirus. Please wear a mask everywhere. And second of all, focus on informal social gatherings. We need to pause these for the next few weeks till we can get these very worrisome trends in new coronavirus cases, new coronavirus hospitalizations, and most worrisome, the increasing death rate in our state from coronavirus. Please, let's all work together and do our best to slow down coronavirus here in Utah.